there is normal bone of the joint, the thigh bone and the leg bone. So it is lined by something known as a cartilage. So bone has a covering of cartilage. This is the normal knee joint, and whole of this is encased in a capsule. This is the capsule. So in arthritis, due to some factors, multi-factors, what happens is there is increased secretion of fluid into the joint from the sides, and the joint becomes stuffy due to increased collection of fluid. And then what happens is there is slight degeneration of the cartilage, due to which the cartilage breaks up. This leads to exposure of raw bone in the joint, and the cartilage has got torn appearance. So cartilage breaks, leading to exposed bony surface. So this is the initiation of arthritic pain, and this is from where the knee starts having multiple issues. The ultimate outcome, or the last grade of arthritis, is called grade 4 arthritis, in which the basic problem is the bones start touching each other. Mostly the inner aspect of the knee joint touches each other than the outer in majority population, but vice versa is also possible. So the increased cause of pain in people with knee arthritis is actual exposure of bone to bone. So it's bone to bone contact, which actually causes pain, and this also causes deformity. So these are the 4 grades of knee arthritis or any arthritis in general. Grade 1 arthritis, the problem with grade 1 arthritis is that there is some degeneration of the synovium, but there is no gross reduction of the space, or the joint space is maintained. In grade 2 of knee arthritis, there is degeneration of synovium, and there is some reduction, very faint reduction of joint space, but there is formation of new bone, that is called osteophytes. So new bone formation takes place, which is just minimum. In grade 3 of knee arthritis, there is some severe reduction in the joint space, but the bone is not touching to bone, and the degeneration of the cartilage is high, and some raw areas of bone are visible. In grade 3 of knee arthritis, these osteophytes, or the new bone, is slightly bigger in size. And in grade 4 of knee arthritis, the osteophytes are very big or huge in size, and there is a bone to bone contact. So this bone to bone contact is grade 4, and it is the last stage of arthritis. And this area where there is bone to bone contact, there is no cartilage. This area has got no cartilage, and this is raw bone which is hitting against each other, and this is a source of pain. And the deformity is highest in grade 4 arthritis. So talking in terms of treatment, the grade 1 of knee arthritis just requires physiotherapy and medications. Grade 2 also requires physiotherapy plus medications plus injections of various nature. It could be a steroid, it could be a platelet-rich plasma, it could be viscosupplementation. In grade 3, the option is more towards surgical than conservative. Still, if we talk about conservative, Then we have to give physiotherapy plus medicines plus injection therapy. So this is grade 4 arthritis. This is the last stage of arthritis, and this is the more common grade at which the patients present in the hospitals, because this is the last stage and patients cannot tolerate more. So the treatment for this is mostly surgical, and practically there is no role of conservative treatment here. It is not recommended, and the ideal treatment is surgical. So surgical treatment in grade 4 arthritis has got a variety, and this depends on actual presentation and various factors. So you know it can be treated with a unicondylar knee replacement. It can be treated with a total knee replacement called TKR, or it can also be treated with a non joint involving procedure, which basically cuts the bone at a different angle and changes the angle. It cuts the bone from here and then changes the angle so that the weight bearing happens at another compartment and not at the damaged compartment. So that gives time for the cartilage to heal up, and that is called as a high tibial osteotomy. High tibial osteotomy, it's also known as a HTO. HTO is quite productive if one of the compartments is involved in the knee joint. There are three compartments in the knee: medial, lateral, and the patellofemoral. And so high tibial osteotomy is one of the very high yielding procedures. Another procedure which is talked about, which is as a variant or alternative to the joint replacement, it is called a high fibula osteotomy. Less often done, but it is getting pace. It's a high fibula osteotomy, and this is also involves cutting a bone called fibula at an angle, at a level, so that it decompresses the involved side and it gives weight bearing onto the another compartment which is having a relatively fresh cartilage, so that the inner compartment gets time, the cartilage gets time. There is some increase in the joint space on the affected side, so that there is a reduction of pain, and the longevity of the patient in terms of performance increases with these procedures. Injections has got a very limited role. Practically none of the injections that have been mentioned, steroid, PRP, or visco supplementation, can get relief in grade 4 arthritis. But if the patient is told about and patient desires only knee pain relief, then a steroid injection can be tried. But all the pros and cons can be discussed with the patient. And this is more or less, in brief, the treatment and the grades of knee arthritis.